Hi, my name is Ryan Peruta, and I'm a student physical therapist at Campbell University. Today I'll be demonstrating the Lachman and Reverse Lachman test for ACL integrity. With your patient lying in supine, you would then grab the knee and place it in 30 degrees of flexion. With the foot off the side of the table, you'll brace against it with your thigh, stabilizing the distal femur with one hand, placing the other hand at the posterior aspect of the tibia, and applying a force towards your body in an effort to elicit any kind of pain or anterior translation. I'm just going to do a quick test to check the integrity of your knee, so if you don't mind laying on your back. Okay. And just relax. If at any point you feel any kind of pain or other symptoms, please let me know. For the reverse Lachman test, you have your patient lying and prone on the table with a bolster under their distal femur. You then place their leg on your thigh and stabilize at the distal femur while applying a posterior to anterior force into the table at the proximal tibia. So I'm going to perform a quick test to check the integrity of your knee, so if you don't mind laying down on your stomach for me. I'm going to place this bolster under your left knee, so if you don't mind lifting up. Thank you, relax. So I'm going to place a force down onto your knee. I just want you to let me know if at any point you feel recreation of your symptoms. Okay? According to Ostrowski, the Lachman test has a sensitivity of 85% and a specificity of 91%. Similarly, Makhmabov et al. Found the sensitivity of the test to be 93.5%, increasing to 97% under general anesthesia. Though both studies concluded that the Lachman test is highly sensitive to ACL rupture, there are those studies whose results question the real value of the test. Dutton notes 4 potentially confounding variables that may serve to explain these discrepancies. They are an inability of the patient to relax, the degree of the patient's knee flexion, the size of the clinician's hand, and the stabilization and thus relaxation of the patient's thigh. The alternate testing position in prone has been suggested to reduce the impact of these factors. According to Mulligan et al., the prone Lachman test was found to have a sensitivity of 70% and a specificity of 90%. The authors noted that the position is better for stabilization, patient relaxation, and for clinicians with smaller hands. However, it is recommended that the test be performed in a cluster to improve the reliability of the results.